always based on the best medical advice and scientific evidence available. And after consulting with the Chief Medical Officer and the Public Health Measures Table, we will be bringing in more public health restrictions to try to stop this virus from spreading any further. Effective tomorrow at 12:01 a.m., we're expanding the masking policies already in place in many communities to the entire province. That means wearing a mask when shopping, when taking public transit, and when at work if you can't keep 2 meters between you and your colleagues. As much as possible, we also need to limit close contact with anyone outside your households. This will be especially important to consider as we look ahead to Thanksgiving next weekend. We also have to extend the pause on the reopening of any other businesses or facilities for another 28 days. And we are bringing in additional targeted measures for hotspot areas for Ottawa, Toronto, and Peel Region. Effective at 12:01 a.m., restaurants, bars, and nightclubs in Ottawa and Peel must limit their capacity to 100 customers or less. Toronto Public Health has already decided to limit capacity to 75, with no more than 6 people per table, and each customer's contact information must be collected for contact tracing. For gyms and fitness centers, group exercise classes will be limited to 10 people, and the facility must limit its capacity to 50 people or less. For banquet halls and event spaces, they must limit to 6 people per table and have no more than 50 people in the facility at a time. My friends, this is serious. We have to offer our full support in every power possible to help our healthcare sector fight this second wave. The weather is driving more people indoors, which has led to more community spread and a surge in testing. As the weather begins to worsen, we can't have people waiting in the cold.
Boss, latest movies घर आ रही, सब कुछ perfect होना चाहिए. Remote control ready.
Waiting in the rain and snow to get a test. So today, we're announcing new changes to help the assessment centers get ready for the winter. Starting Tuesday, October the 6th, all assessment centers will be moving to appointment-based testing only in order for our assessment centers to make the necessary adjustments in order to winterize their operations. Beginning Sunday, October the 4th, assessment centers will not be accepting walk-ins. The vast majority of the assessment centers in Ontario that already offer testing by appointments will continue to operate as usual while we make this important transition. If you have already booked an appointment, don't worry, it will proceed as scheduled. Up to 80 pharmacy locations in Ontario will also continue to offer tests by appointment, with more pharmacies to offer tests in the coming weeks. While they transition, the assessment centers will also take the opportunity to conduct a deep cleaning. This will also give the labs a critical opportunity to clear the testing backlog. My friends, these changes are absolutely necessary. Being able to make an appointment, it gives certainty. It will make sure folks don't have to wait outside for hours. It will help us ensure necessary screening takes place to ensure those who need a test can get a test. And it will help us ensure we can get your results back sooner. We're working with our partners in hospitals and assessment centers to make sure this transition to testing by appointment is as smooth as possible. But folks, I have to ask for your patience as we make these changes. It might take a few days to schedule your test at the start, but we're working around the clock to keep those times as low as possible. We'll be adopting the latest testing technology and methods to allow us to test more people faster. I want to reassure people, the entire team at Ontario Health, the hospitals and public health staff, they're all working extremely hard. And I have to send a very special thank you. Thank you from the bottom of my heart to the incredible, and they're very incredible, lab technicians. Thank you to everyone who has been working tirelessly around the clock for months without a break to make sure we can keep testing people each and every day. Folks, these people have been unsung heroes. Thanks to them, we have done more testing than all of Canada combined. So please, if you know a lab technician, thank them for everything they've been doing. By working together and supporting them, we can keep people safe and turn the tide of this battle. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Protecting the health and well-being of Ontarians has been our government's top priority since the very start of this outbreak. This is our duty to the people of this province. Now, as the Premier has just outlined, we are seeing more and more positive cases, and we need to take action to break this trend and ensure we can keep Ontarians safe. To do that, we need to take hard but necessary measures. Wearing masks while working indoors if physical distancing is not possible, limiting close contact to only those in our households, and placing limits on our bars, restaurants, gyms, and banquet halls, and providing additional guidance for seniors on how to minimize their risk of acquiring COVID-19, including for upcoming annual gatherings such as Thanksgiving and Remembrance Day. These are all actions we can take that will help us to prevent further spread of the virus. We received a letter from the Medical Officer of Health for the City of Toronto requesting these measures, echoing the concerns we have been hearing from many other public health units across the province. And we are working closely with the City, as we are with all of our partners in public health, to address these concerns. We are also taking important steps to ensure anyone who needs a test can get one quickly, so they don't have to wait for long periods of time to receive a diagnosis. Moving to appointment-based testing, continuing our mobile testing and pop-up testing centers to target and reach vulnerable populations, and investing to increase our lab capacity even further. These are all steps that are going to help us identify new cases more quickly and help us to contain the spread. These measures will help us protect each other. There is a lot at stake. We need to take these very necessary steps to protect our economy, to protect our schools, and to keep everything open so that people can continue to earn a living. The reality is that these measures are necessary to protect the health and well-being of Ontarians and, of course, to prevent future lockdowns. So I want to emphasize once again the need for people to continue to follow public health advice. Please stay home when you're not feeling well. Please continue to practice physical distancing. Wear a face covering when physical distancing is a challenge or where it is mandatory to do so. Remember to adhere to gathering limits and wash your hands frequently and thoroughly. These are still the best methods of stopping the spread of this virus and to protect ourselves, our families, our friends, and our neighbors. Thank you.
I guess, Ivana, before I start, folks, we've went through a lot over this pandemic, and we've always been able to get over bumps and hurdles together as a province, all 14.5 million people pulling in the same direction. But I want to acknowledge our team behind us. Dr. Williams has been absolutely incredible, and by the way, they've all been working around the clock. Dr. Heyer, you've heard me refer Dr. Heyer as Dr. Dirk, same person. He's a great doctor. And you've heard me talk about a guy named Matt Anderson for so long, the CEO of Ontario Health, and talk about champions. And there's only one mistake Matt has made throughout this whole pandemic. When we first hired him, it wasn't short after the pandemic hit, and I'm not too sure the time frame, but I'm sure he didn't sign up for this. But only one mistake is he gave me a cell number, and once he gave me a cell number, that was a big mistake, because I call this guy, poor guy, Saturday, Sunday, every day. But he's an absolute champion. The reason our numbers are going up on the testing and watching everything is between public health and Dr. Dirk and Matt's leading the charge over there. I'm so blessed, and I'm where I'm really blessed is having someone as solid as a rock as my Deputy Premier, Minister of Health, Christine Elliott. You've been absolutely incredible, stood beside me every single day throughout this pandemic, and I just want to tell the people I'm very grateful. And behind each and every person here, there's hundreds of professionals behind them, part of their team, their associates that they work with every day, from doctors to technicians, epidemiologists, and everyone else under there. So we have a really, really solid team here in Ontario, and I just want to tell all the folks I'm grateful. Thank you so much. We're ready to take the questions.
Okay, we'll go to the phone line. First question, please.
First question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Mike.
Hi, Premier Ford. I was told that before your cabinet was a proposal to declare a color-coded zone system to kind of make it clear what the level of risk from COVID-19 is in the different regions throughout the province. So it would be a system similar to what they have in Quebec, of red, orange, yellow, and green. And I'm also told that you had a conversation with Premier Legault about that kind of a system.
Yeah.
Why has the government not moved to that sort of a system, given that it would really clearly communicate to people what they should be doing, as opposed to these piecemeal changes to what the restrictions are?
So I talked to Premier Legault about this, and he said it was very, very confusing to the public, and you're constantly changing the colors. And you know, I really like where we're going stage. You know, we went through the stages, and now the hot areas, hot spots, we're working on. It's pretty clear. Ottawa, Toronto, and Peel, they're the hot spots. But he told me it's very confusing, and you have color changes every single day, and people are looking what color it is today. So I think we simplify it, and we work on these hot spots.